Hello physio friends. Today we shall learn how to get rid of trapezitis with physiotherapy treatment. This is a beginner's guide. Neck pain is a common problem for many people, with a prevalence between 10% to 15%. There are many disorders in different parts of the human body, but neck and upper extremity disorders are the most reported. Out of all neck disorders, trapezitis is reported frequently in physiotherapy clinics. To understand why you have trapezitis, it is important to look at what causes it. You might find that a variety of physical factors are at the root of your symptoms. The pain of trapezitis can be caused by the strain on your neck from regular neck bending. Daily work posture is one of the primary causes of this type of pain. Along with pain, the muscle develops a knot or cramp, better described as segmental spasm in the muscle. Biomechanically speaking, the upper trapezius muscle is designed to act as a postural muscle, and thus it is bound to be overused as compared to other muscles of the neck. Now let's look at how can you assess a patient with chronic trapezitis. Your patient will complain of severe pain for more than 3 months. The patient complains of inability to turn their head. They may say that their pain is present even during rest and is aggravated by activity. When you check the range of motion for such patients, you might find that passive range of motion may be restricted due to pain. When asked about lifestyle, you might find that they use mobile for a long period, or work from a chair set too low for the desk, or play musical instruments for a long period.
These patients are frequently under stress, have repetitive head and neck movements, or have a habit of sitting without back support, use a thick pillow, or have tight pectoralis major muscle. Physiotherapy treatment for such patients includes a variety of treatments, such as using ultrasound or other manual therapy. Muscle energy technique is a new treatment that many authorities have been recommending lately. But what is MET? Well, let's study the technique in detail. This technique was firstly described in 1950 by Dr. Fred Mitchell Sr., an osteopathic physician. MET is a manipulative treatment where you contract your muscles isometrically from a certain position and with an opposing force. The muscle energy technique used for trapezitis is called post-isometric relaxation. The term post-isometric relaxation refers to reduction in tone experienced by a muscle, or group of muscles, after brief periods of isometric contraction have been performed. The reason the muscle relaxes is because there is loading of Golgi tendon organs present in skeletal muscle tendon. Because of an isometric contraction, which produced a post-isometric relaxation effect in that muscle. There are many researches in favor of muscle energy technique as a treatment option for chronic trapezitis. You can find a few research articles in the description of this video. Now let's see how can you apply this technique on your patient. In order to treat all the fibers of upper trapezius, MET should be applied sequentially. The upper trapezius is subdivided into anterior, middle, and posterior fibers. The patient is positioned in supine lying position. The therapist stands on the head side of the patient. Let's suppose that we are treating right side here. With one hand, the therapist stabilizes the right shoulder and with the other hand cups the ear/mastoid area of the right side of patient's head. Next, ask the patient to give a light resisted effort. Ask the patient to take the right shoulder towards the ear, a shrug movement, and ear towards shoulder. The degree of effort should be so mild that no pain should be reported. Sustain this contraction for 10 seconds. Upon relaxation, the therapist moves the neck into side flexion while the shoulder is stretched downwards. Once the patient feels the stretch and reports it, the therapist holds that position for 20 seconds. This train of contraction and stretching is repeated 3 times in a session. This is a general technique for the whole upper trapezius, but we can also treat anterior, middle, and posterior fibers separately by keeping the neck in different positions. Let's have a look at those positions. For anterior fibers, keep the neck fully side bent and slightly rotated towards the left side. For middle fibers, keep the neck fully side bent and half rotated towards the left side. For posterior fibers, keep the neck fully side bent and fully rotated on the left side. Now that you know how to apply this technique, let's take a look at how it works. To be honest, We don't know much about how muscle energy technique works, but here we shall see the most prevailing theories. Theory 1, pain relief may involve central and peripheral pain modulatory mechanism. During isometric contraction, muscle and joint mechanoreceptors are activated, hence they activate centrally mediated pathways, like the periaqueductal GRAPE, PAG, in the midbrain, or non-opioid serotonergic and noradrenergic descending inhibitory pathways. This might be the reason for pain reduction after this technique. Theory 2, MET may increase fluid drainage and promote hypoalgesia. As muscle is contracting rhythmically, so it pushes blood full of oxidatives out and new blood full of oxygen and nutrients like glucose enters the muscle. Theory 3, the MET application may reduce inflammatory cytokines and desensitize peripheral nociceptors. Theory 4, the application of MET also improves length of the muscle. The idea behind this is the more you stretch a muscle, the more its tolerance to stretch increases and the more its length increases. This was it for today. Thanks for watching. If you like the content, share it with your friends and subscribe to watch more.